Hello, this is Carlo Martuscelli, health reporter with Politico Europe. Today, I'm honored to be speaking with the Health Minister of Poland, Adam Niedzielski, and we will be discussing some of the issues we touched upon in the earlier session, like the enduring gap in health outcomes between East and West. And of course, we'll also be talking about the ongoing pandemic, which is showing no signs of ending. But before we start the interview, a few housekeeping rules. Please do ask questions on the swap card platform. Instructions are on the event website. And please do engage on social media. You can tweet with the hashtag #PoliticoHealthcare. Minister, thank you so much for joining us today. It's a delicate situation all over Europe, and we're seeing a sharp increase in cases in many countries in the bloc, including in Poland. We can take a look at the situation in Romania, for example, which has reached a record of hospitalizations it hasn't seen since the start of the pandemic, as an example of what could go wrong. At the same time, it seems like momentum to get new people vaccinated has ended. Minister, Poland recorded 8,000 new cases yesterday, which was the highest number since April. You had mentioned that the country would consider imposing new restrictions if the situation continued. Can I ask, what restrictions are you looking at the moment?
Good afternoon to everyone. Good afternoon, Carlo. First, let me say that it is a great pleasure to have opportunity to talk to you. And actually, the problem of rising pandemic that you described just a moment ago is actually the major issue for me right now. I can also say that I had an opportunity to speak with the Minister of Health of Romania, so we are in a close cooperation right now, and Poland actually accepted to treat 9 patients from Romania. They were transported by airplane to Poland. So actually the situation in Poland is tough, but still we try to help anyone that this help is needed. Actually, as far as come to our attitude to the restriction, I think it is totally different than it was a few months ago, because we clearly see that the influence of vaccination is really visible. I mean that just as you say, we have today a little above 8,000 new cases, but actually a year ago, in the same day, we have almost 18,000. So one can clearly see that the difference is huge. And what's more, this difference also relates to the hospitalization. Right now, Poland has around 5,500 of patients hospitalized. And actually, a year ago, it was 13,000. So one can clearly see that the difference between those 2 years is explained probably first of all by vaccinations, and what it means from the point of view of restriction, that we have a higher tolerance level for the new cases. So still the average from the last week is around 6,000 new cases. And from our point of view, this is not actually the level that we want to push to introduce new restriction, especially that we have to take into account that society attitude towards restriction is totally different than it was, for example, a year ago.
Great. Can you elaborate on that last point you just made, Minister, about societal attitude towards restrictions? Do you think it would simply be impossible to impose a lockdown or at least severe restrictions at this point? Has public opinion turned?
Definitely, public opinion is much more against any restriction that it was a few months ago. This is probably the same phenomena as we see on this vaccination sailing. I mean that we reach the point when there is very tough, very hard to increase the rate of vaccination in Poland. And those two factors, I mean the negative attitude toward restriction and this sailing for vaccination rates, they are because we have some kind of pandemic fatigue, as I say, that society is really tired with all this history and they want to come to normal life, even if the price is high. I mean that the price is to tolerate the higher rate of new cases, the higher rate of hospitalization. And I think that actually, from my point of view, this is one of the main reasons, factors that I have to focus on to deal with this social attitude, which is really a little bit difficult in order to manage effectively fight against pandemic.
To elaborate on this point on social attitudes, Poland is in the bottom half of the table for European countries in terms of vaccination rates. At the same time, you mentioned that social attitudes at the moment bristle at impositions or social restrictions. But are you considering an Italian or French-style green pass as a solution to try and get those rates up?
Actually, we have to take a look at this problem not only from perspective comparing different countries within Europe, but we should take some other context. I mean that still the vaccination rates in other spheres are rather low in Poland. I mean, for example, when you take a look at the vaccination rates against flu, Poland was always in the second half, as you said, of the Europe. So from that point of view, this ability to vaccinate is rather low in Polish society. This is, of course, a very bad argument for me. But when you take a look, for example, at the December of the previous year, we had a special research on the ability to vaccinate, and the rate in December was 37%. Starting from that date, we made a lot of effort in campaigns, in other instruments targeted and increasing the vaccination rate. And right now, we have over 70% of society convinced that vaccination is a good way. So not only comparison to other European countries matters, but also it is important that still we have a really very, very difficult educational mission in order to convince people that vaccination is a good instrument in fighting pandemic, but of course taking care about their own health.
Great. Thank you. Just to take a step back from the pandemic situation, have you been hardened by the European response, also in terms of just general health cooperation? I mean, you mentioned that you were taking some patients from Romania. Do you see scope for cooperation to continue outside of the pandemic and to maybe also help bridge some of those gaps in health outcomes we mentioned in the previous session?
Yes, I had opportunity to listen to the previous session. It was, by the way, very interesting. But I have to say that a lot was said about data, and I think that pandemic shows that data in the process of management, managing the fight with pandemic are really critical. I mean that without internal data, I mean in Poland, without having opportunity to compare this data to other countries, exchange of data in the sphere or in the this information about mutation, about the possibility of new mutation and what kind of danger is related to them. These issues seems to be crucial, and I have to say from my point of view that actually on everyday basis the special crisis team, which is in the Ministry of Health, analyze all this data that comes from different European institutions, and they are really, from my point of view, crucial in the process of managing the fight with pandemic. So data and exchange of information is really the key issue in this cooperation. I think that we shouldn't stop here, that one step forward, it is very important to move this cooperation to the real sphere, not only this virtual when we can exchange the data, because this kind of help that we offer and we can offer to Romania, but also to Lithuania, should be the standard among European countries. And from this European perspective, there should be some kind of information for every member country. Where can we achieve this real help? I mean, for example, medical teams which can help. I mean, the free beds in different countries, because transportation right now is not such a huge issue. We have good highways and, of course, airplanes who can transport and deliver patients. So I think that talking about only exchange of information, this is too little. We should definitely exchange information and this real help among member countries.
Recently, Poland passed the one-year anniversary of its ban on abortion. Minister, I wanted to ask, do you know what the health consequences have been? Do we know if we've seen an increase in women seeking illegal abortions, for example, and has that had a health impact?
Yes, that's true. Actually, this is 1 year, but still, actually, abortion is possible in Poland. Because of pandemic, of course, we didn't tackle this statistic, especially how many this kind of operation are made abroad. But I think that from this general point of view, actually, we don't see any special and a substantial difference.
Understand. Thank you, Minister. I know you have a background in health economics yourself, and in the G20 is meeting in Rome this weekend, and on Friday there will be a meeting of health and finance ministers. They're going to discuss a proposal put forward by former Italian Prime Minister Mario Monti to create a joint financial health forum. In Mr. Monti's proposal, he said this forum could help tackle market failures in health. I wanted to get your views on this. Would you welcome this kind of supranational, high-level financial cooperation in the health topic?
From my point of view, this is not the kind of question that I can answer in a simple way. There are so many differences among healthcare system within Europe that sometimes it is very tough to find a common solution which will be good for everyone. I think that we should discuss this kind of issue individually. I mean that, for example, in the previous session, you talk a lot about the purchasing mechanism for medicines. And from my point of view, of course, in this time of pandemic, it appears to be a very good solution. But in other cases, for example, in medicines, we can see that the level of prices that we have to pay when we pay together with strong economies are really high from our point of view. And actually, when we conduct individual negotiation, we have opportunity to gain, to have better prices. So actually, when we are talking about the financial mechanism, we should be very careful and see the differences in systems, in economic strength of specific countries. But anyway, the forum for discussion should be established, and of course, Poland will welcome such an initiative.
Great. I'm aware we're reaching towards the end of our discussion, but before we go, I wanted to ask one last question. The Commission Vice President, Margaritis Šinas, earlier in the day mentioned that he would be open, in theory, to expanding the EU's health competences through a treaty change in the future, should member countries want it. Minister, can I ask, as a representative of Poland, would you be open to a treaty change to give Brussels more power in health?
I think that the health system, because of the reasons that I mentioned before, so first of all, there actually are no such two the same systems within Europe. I'm talking about the healthcare system. So actually, I'm not sure if this is a good area for spreading the competences of European Union. I think that first we should try to standardize some element of the system and then start discussion about some common agreement on how to deal with these issues. So first, probably standards and discussion what seems to be or should be standardized. I mean, for example, exchange of information about patient and other areas, and then create some common agreement on competences of European Union in this area.
Great. Thank you so much, Minister. We've reached the end of our discussion. It's been great having you today. I think if one theme has emerged from both our session and the previous one on bridging inequalities is just how important it is to have data, and the fact that data can actually be a mechanism of bringing different countries of the EU together, standardizing processes, centralizing them, being able to then act more effectively and help each other out, much in the way that Poland is doing with Romania at the moment. Data, of course, is a way to better understand, what is going on in Europe's health system. It's also a way of measuring what we might be able to call the truth, as Dr. Anthony Fauci put it yesterday. He was very attached to this idea that science, the scientific process, and data collection is a way to converge on a shared reality. One thing that's clear from the summit is that this year is very much a year of flux. If last year we were still at the beginning phases of the pandemic, right now we're much more at an intermediate phase, and we seem to be deciding, what have we learned? What are the things we want to bring forward? What are the things that we want to leave behind us as just emergency pandemic time measures? The picture is still very unclear. I think even with the pharmaceutical strategy, for example, a year on we'll have a much clearer picture. Also with pharmaceutical production itself, it's clear that we want change, but maybe it's not clear so much what this change will look like in practice. So, of course, everyone attending the Politico Healthcare Summit, you will have to return next year to see how these issues have panned out. Minister, once again, thank you so much for joining us, and I hope we'll be able to speak again in the future. For everyone who is watching online, this is where the session ends, where the summit ends. For everyone who is here in person, we will be having a networking lunch in the next room. And there are two roundtable discussions for online viewers, so it's not completely over. We have one roundtable discussions on healthcare in Europe. What role should regional actors have, moderated by Ashley Furlong, fellow Politico healthcare reporter, and we have a second roundtable discussion on trade, Can Health Escape Politics, moderated by Helen Collis. Thank you all so much for watching. I want to give a big thank you also to our leading partner, Janssen, as well as to our presenting partners, Teva, Lilly, Viatris, and the Global Self-Care Federation. Once again, I made it clear already, but the summit will happen next year around the same time. So we hope to see you all again next year. Thank you all so much.